All right, everybody, welcome back. Today, we're going to do a deep dive into radiology coding.
All right.
We're going to be looking at these facts to remember, or FTRs,
Okay.
from the Absolute Medical Coding Institute's MCG manual.
Hmm.
And by the way, if you want to check that out, we've got a link for you in the description.
Right.
These FTRs, they're kind of like cheat sheets, right, to help coders figure out those CPT codes,
Yeah.
especially when they're studying for those certification exams.
Yeah, that's right.
You know, they can get pretty tricky sometimes.
Exactly. They really can. They break down those complex coding guidelines into those manageable pieces. And it's all about making sure that those medical procedures are coded accurately.
Yeah. Okay, so let's imagine you're a medical coder.
Okay.
You're looking at a radiology report.
Right.
Where do you even begin?
Well, the FTRs actually lay out a pretty clear path.
Okay.
So imagine you're looking at a report right now.
Mm-hmm.
The first thing you need to figure out is what technique was used for that imaging.
Right.
Was it a CT scan, MRI, simple X-ray?
Right.
These all have different code series. So
Yeah.
that's your starting point.
Okay, so the type of imaging matters.
Yes,
But then I'm guessing the location that they're imaging is just as important.
absolutely.
Right. Like a chest X-ray is going to have a different code than, say, an X-ray of a foot.
That is correct.
Okay.
The body location or the area being imaged is crucial.
Right.
And then it even gets more granular than that.
Oh, really?
You need to consider the radiographic beam position.
Okay.
For example, was the image taken from the front to back?
Mm-hmm.
That's called anteroposterior, or AP.
Okay.
Back to front would be posterior-anterior, or PA.
After?
From the side lateral, or at an angle oblique.
Wow, that's
Yeah,
way more detailed than I would have ever thought about.
right.
But I guess it makes sense. The beam position changes what the image shows.
Absolutely. Each beam position highlights different structures.
Okay.
Gives the physician different information. And that's why it impacts the code that you would choose.
Gotcha.
It's about accurately reflecting what that image is actually showing.
Okay, that makes sense.
Yeah.
So what else do we need to consider?
Well, the patient's position also plays a role.
Okay.
Were they laying on their back supine, on
Yeah.
their stomach prone,
Right.
or on their side lateral?
Okay.
Just like the beam position, the patient position affects how that image turns out.
Right.
And then there's the question of contrast.
Okay.
Was it used during the imaging?
Right.
And if so, was it with contrast, without contrast, or with and without contrast?
Wow.
This might seem like a small detail,
Yeah.
but it actually has a big impact on the complexity and the interpretation of that image.
Okay, so it's not just about whether contrast was used.
Exactly.
It's about how it was used.
Right.
Yeah.
Starting
Yeah.
to see how all these little details, they really add up.
Yes, they do.
Yeah.
They really do. And here's a little nugget of wisdom straight from the FTRs that can trip people up. Okay.
If the imaging was done via the oral or the rectal routes, those are not considered contrast assessments for coding purposes.
Okay, so those are considered separate procedures.
Exactly.
Gotcha.
You also have to consider the components being reported.
Okay.
The technical component, that's the TC.
Okay.
Think of that as the equipment and the staff used to take the image.
Right.
The professional component, that's the 26.
Okay.
That's the physician's interpretation of the image.
Right.
Or both.
Okay.
If it involved interventional radiology or surgery, was there supervision and interpretation?
Right.
All of these add layers to the coding process.
Wow.
And a key tip from the FTRs,
Okay.
always double check if it's a CT versus a CTA
Okay.
or an MRI versus an MRA.
Right.
Those subtle differences
Yeah.
indicate separate procedures
Okay.
and have their own specific codes.
Okay, so we've covered like the basics of radiology coding.
Yes.
Now let's dive into a more specialized area.
Okay.
Obstetrical radiology.
Okay.
What makes coding for those OB ultrasounds unique?
Well, you have specific codes for very specific scenarios.
Okay.
Let's say it's what they call a quick look at one or more elements.
Okay.
That would be code 76815.
So what exactly does a quick look entail?
Good question.
Yeah.
It's essentially a limited ultrasound exam,
Okay.
often used to quickly check for things like fetal heartbeat, presentation, or placental position.
Okay.
It's different from a more detailed reassessment of fetal size growth or abnormalities,
Right.
which would be code 76816.
Yeah, sure.
That involves taking more measurements
Go ahead.
and making comparisons to previous scans.
Ah, so that's why there are separate codes.
Exactly.
Yeah.
They represent different levels of complexity
Right.
and the amount of information being gathered.
Makes sense.
Yeah.
So then what about when you have multiple fetuses?
When you have multiple fetuses, modifier 59 is critical.
Okay.
This modifier signals to the pair
Yeah.
that you're performing separate, distinct procedures. And this is crucial for getting proper reimbursement.
Modifier 59 sounds like a good friend to have when you're dealing with multiples.
Absolutely it is.
Yeah.
And don't forget about Doppler studies.
I
Those might also need separate coding, depending on the situation.
gotcha.
It all boils down to understanding which services are truly distinct.
Right. Okay, let's shift gears now.
Right.
Talk about radiation treatment management.
Okay.
How does coding work in that area?
It primarily revolves around the number of treatments or fractions delivered.
Okay.
If it's 1 or 2 fractions, you use code 77431.
Okay.
3 to 7 fractions.
Uh-huh.
That's 77427.
Okay.
But here's the interesting part.
Okay.
If the patient receives more than 7 fractions, you start adding units of 77427.
Okay, so give me an example. Like if someone had, say, 9 fractions.
Okay, so if someone had 9 fractions,
Yeah.
you would code that as 77427 multiplied by 2.
Gotcha.
Okay, it's important to remember that clear documentation is essential. The total number of fractions needs to be recorded accurately to ensure correct coding.
It's more than just numbers on a page. You know,
it's like-
it's about making sure that the patient's treatment is billed correctly.
Exactly.
Right.
Yes,
These FTRs really are like a secret decoder ring
they are.
for the world of radiology coding.
They really are, and they're an incredibly valuable resource,
Right.
especially for those preparing for those certification exams.
For sure.
Yeah,
We've covered a lot of ground today.
we have.
I feel like we've only just scratched the surface.
There's always more to learn.
Right.
It's a constantly evolving field, especially with all the advancements in medical technology.
That makes me wonder,
Yeah,
how do you think radiology coding will adapt
right.
to keep up with all these new technologies?
That's a great question.
Yeah, something to think about.
It is a fascinating question, for sure.
Well, on that note,
Yeah.
we're going to wrap up our deep dive for today.
Okay.
Don't forget to check out that MCG manual.
Yeah.
The link's in the description.
Please do.
If you want to explore these coding guidelines
Yes.
in a little more depth.
Good stuff.
All right. Thanks for joining us, everybody.
Thank you.
We'll see you next time.
Bye.
Bye.